Hi there. So, I've done a video audio recording that I shared here talking about alcohol, as I nicknamed it the sweet die hard. And the reason behind nicknaming it the sweet die hard is it's sweet on the tongue, but when it becomes a habit, it's difficult to break free from or to break away from. And I was able to talk about habits or behaviors that we could adapt as we adjust with the changes of wanting to keep away from alcohol dependence or alcohol addiction. I mentioned nature's appreciation, the appreciation of art, swimming, and swimming is an art that has to be taught and to be done safely. An individual who wishes to become a swimmer, not specifically or generally to do it for sports or for money, just for recreation, just to be happy when doing it or while doing it, they have to learn. They have to be taught so that they don't drown or die in the process of swimming. Now, human connections, bonding from conversations and dialogues is also another very potent or very effective way of drawing away from alcohol, the sweet die hard, as I call it. Now, today I wish to talk about two things generally, or specifically. I'm going to talk about craving behavior, and I'm going to talk about withdrawal symptoms as regards keeping away from alcohol or alcohol abuse, the sweet die hard. Now, an individual who has developed tolerance and dependence or addiction on alcohol, who wishes to keep away from it, will experience craving. Who wishes to withdraw or keep off of it will experience craving. And craving is physiological, and craving is mental, and craving is behavioral. It's physiological because the brain has become used to it and the body has become used to it. It's mental because when the physiological self begins to demand for alcohol, the person's brain is going to suggest to them to engage goal oriented behaviors targeted at or directed toward places where they're going to get the substance, alcohol, or the sweet die hard, and ingest or consume or drink. So that's craving behavior. Now, craving also happens when the person is actively in the phase of abuse or misuse of alcohol. However, withdrawal symptoms only happen when the person is trying to keep away from, to break free from the habit of alcohol abuse. So, there are generally 6 withdrawal symptoms I'm going to mention, beginning from the first one, which is anxiety. There is irritability, there is tremors, there is nausea, there is insomnia, and the final one would be sweating. Now, like I said in the other video, it's not every individual who is a user or abuser of alcohol that would have to be hospitalized because of dependence or addiction, that would have to go through the process of detoxification, that would need to go through therapy or psychotherapy or counseling for them to learn how to lead a life that is developmental, a life that is goal oriented. It's not every individual, but there are some individuals who would become, when they become hooked or dependent on this drug, their productivity, general productivity, if they're a student in school pursuing academics, it becomes difficult. If they are married, it becomes difficult with keeping up with their marital responsibilities. If they're a Christian or they practice any religion, it becomes difficult with keeping up with the practices of that religion. If generally yes, every individual must have social connections, and so there are times when alcohol abuse makes it difficult to form connections or to keep those connections, even with the people that it has already been formed with. So that's the thing. Now, another aspect of an individual's life that may be affected by alcohol dependence, alcohol addiction, is their work life. Now, if they are employed, it could perhaps they could take so much of it over the weekend, and on Mondays they go to work late. Now, that's absenteeism. They may be queried, or generally some other aspects of their lives that they themselves may be able to acknowledge, or may be able to say that yes, in this aspect or in another, this substance is actually affecting me in those areas, as they're not being positive about those areas. Now, that that's generally now about a craving and withdrawal symptoms. So connections with individuals that do not judge, individuals that do not remind you about your past, when you were an addict or when you were dependent or when you were hooked. So the best of those connections could be with your therapist or just any other person, friends, associates, and family members. Now remember, the withdrawal symptoms that I mentioned are induced by alcohol withdrawal. And I'm going to go over them again. Now, the first one is anxiety. The second is irritability. The third is tremors. Fourth is nausea. There is insomnia, and there is sweating. Now, these symptoms are not exactly only symptoms for alcohol use or alcohol abuse, or withdrawal symptoms from alcohol abuse or alcohol misuse or alcohol addiction. And so it becomes very important to do what I would call differential diagnosis. And so, because they are not exactly or accurately only symptoms for withdrawal symptoms for alcohol, the clinician would have to do a differential diagnosis to be able to establish that presenting with these symptoms by this individual or by this patient is for alcohol withdrawal or alcohol addiction. So, human connections, very important conversations, bonding with nature by appreciating nature, appreciating art, swimming, running, and there you go. Try it.